Alrighty, hello guys. Welcome to our series on mobile ultrasound business tips. So this is a series to where we're just sharing tips for the mobile ultrasound business, things that can help you guys out. So mainly, most of this content will be housed inside the online consulting portal. Here and there, we will share content outside of the mobile ultrasound online consulting portal as well. But this video right here and this tip structure and we'll get into it as we go along, but it's designed to give you as the mobile ultrasound business owner and your mobile ultrasound business company multiple options and more options for billing and actually increasing revenue and increasing your reimbursements from your patients without having to be an IDTF or without having to get credentialed with insurance. And we'll go more into that in a moment. So like I said, this is mobile ultrasound business tips presented by myself and mymobileultrasoundbusiness.com. So for any other questions or to book a consulting call, go to www.mymobileultrasoundbusiness.com. And this is pretty much where we house our online portal, and we have our consulting program where we help ultrasound business owners and mobile ultrasound business owners and those who strive to own a mobile ultrasound business, get the help they need and get the contracts and compliance they need in order to start this business and do it compliantly and efficiently and effectively. So, alrighty, here's just a little introduction. A lot of you guys already know this, so you can just read through it, check some of it out. So, my background is in general vascular, OBGYN, small parts. I have a certification in MSK, so have some experience in that as well. Certified in marketing, Google Analytics, Google Search, Google My Business. Have over 10 years experience in that, as well as like setting up telemarketing campaigns and helping mobile ultrasound business owners run their telemarketing and outreach campaigns that reach out to physicians' offices as well. So a lot of extensive experience in marketing that we have as a consulting firm, and we're here to help you and share that with you. So additional history: worked in hospitals. I've done that. I've been there before leaving to the mobile world and contract work world. So for me, the contract world and the mobile world is much more rewarding. It's much more independent as well, which has its pros and cons. Sometimes it can get lonely being out there by yourself, but it's very rewarding and it's very, very different. You're much more independent as compared to being in a hospital. Um, let's see. So yeah, so some of the facilities I've worked at: USC, San Diego, Baylor, Texas Health, many other facilities around uh, the the United States. So we have obtained and performed mobile ultrasound contract work with physicians and clinics through the following states there: Alabama, Georgia, Texas, Kansas, California. And the mission here is to help those interested in starting a mobile ultrasound business do so compliantly, efficiently, effectively, and affordably. And we have a heavy focus on compliance, and then next after compliance is a heavy focus on marketing. So we also want to help those same clients obtain their first client and their first account to service. And the reason why we say first, because once you guys see how to do it one time, you can just repeat that process over and over and over and do it multiple times. So on this tip, we're going to just be talking about how to bill patients insurance without becoming an independent diagnostic testing facility, which is an IDTF, and without getting credentialed with providers such as Medicare, Medicaid, CMS, Blue Cross, United Healthcare, Aetna, all the different insurance providers, all the different HMOs, all the different PPOs. So we're going to show you how to do this without actually getting uh, those credentialing and because as you know that a lot of that stuff takes lots of time. Sometimes it can take months, sometimes it can take over a year just to get back results from your credentialing applications and to get either approved or accepted. So this is kind of like a little workaround method that we teach in our program and that we show people how to do. So who is this training for? So this little small brief training is for those interested in helping patients save money. Also for those looking for alternative billing methods for your mobile ultrasound business, as well as those who are looking to help patients who otherwise might not be able to afford imaging services. And lastly, is for those who want to help patients access services not covered or not provided in doctors' offices. So basically in this, we're just going to show you how to still get access to the patient's insurance and still help the patient get the imaging services that their physician and their doctor ordered without having to become credentialed directly with the insurance providers. And this is just kind of like a outside way to do it, kind of like a workaround. So basically, here are like the steps for billing and reimbursement. So first of all, you're going to have the patient and their physician or doctor is going to order the ultrasound, right? So you do have to have an order from them in order to do this method. So you're going to get that order. You're going to make sure that it has all the right information on it. And we'll go into that as in a moment as we look at some of the forms. But at minimum, it should have the patient's information on it, the patient's um, the the test that is being ordered. It should have the CPT codes. It should have the ICD codes. Um, and also, then we'll talk about like on the actual form that you're going to fill out for reimbursement, and you're going to help the patient fill out. There's also additional information that is required as well. So okay. So now you have a patient. The patient needs an ultrasound. The patient has checked with the hospital. The hospital says, "Hey, this is gonna cost you $250 out of pocket." Or the hospital says, "Hey, this is gonna cost you 300 out of pocket." Patients want to look into their options, or the patient just wants to shop around, but they have this order and they somehow come across your company either through your marketing methods or even just through your promotional and marketing methods when you're out doing your outreaches and you're letting the doctor's office know that, hey, you have this access to this service. You can just bill help bill patients insurance directly, and you do that by pretty much just getting the reimbursement on the back end at a later time. So this is pretty much how this works. So number one, you're going to develop your fee schedule and set your price for your services. So similar to like insurance companies, you're gonna decide what your minimum allowable fee will be, and we put this in place just kind of like as a safeguard, just to like have you get that minimum amount. Like for example, let's say the reimbursement doesn't come through, you're gonna always collect your minimum allowable amount, and you're gonna see why as we go on. So let's say you have your service for an abdominal ultrasound priced at 185. You might set your minimum allowable at $85. So basically, when the patient comes in to receive the service, you'll charge 85. You'll go ahead and collect that 85 up front. And so what happens is, let's say the claim for any reason is not approved, you can simply forgive the rest of the amount if the claim isn't approved. If you want to, you can collect, but I mean, you can also collect directly from the patient since they technically still would owe you the $100 remaining balance. But it's not necessary. So basically, you can collect the 85, or you can just not collect anything up front and just wait for the reimbursement to come in. But I would recommend just collecting at least something, just so you have at least something, just in case it doesn't get approved, and then down the road you're not just chasing the patient around and trying to collect another fee. You can just forgive it if you want to. Um, okay, so like I said, you basically collect your minimum down payment at the time of service, and then you're taking a deposit payment from the patient, which is that $85. So pretty much they will owe a balance on the remaining amount once it gets reimbursed by the insurance company. Alrighty, so next you will help your patient find and fill out the reimbursement form from their insurance company. This is usually known as health benefits claim form for services rendered or performed out of network. So your super bill should include all the following information required and listed in the claim form. So you want to make sure you fill this out as accurately as possible to avoid potential delays and potential denials for the claim. So you want to submit the form to the insurance company along with the required documentation listed. You want to make sure your billing team is following up on revenue collections and the status for these claims regularly, at least 1 to 2 week, and at least 1 to 2 week intervals after 30 days. You want to use the assignment of benefits form, also known as the AOB form, to allow direct payment of claims to a provider. And guys, for those that don't have the AOB form, this is we do provide an AOB form in the ultrasound portal and our consulting portal. Basically, it's an assignment of benefits form to where they assign the benefits from the insurance company directly to you for those services rendered or those services provided that you offer to the patient or that you perform for the patient. So that's pretty much it. So now you guys got the general gist. Like I said, in your bill, you just want to make sure you include the following information that we're gonna talk about in just a moment. And so now we'll just kind of look at some sample claim forms, and you guys are going to be able to help the patients look up these claim forms. So like I mean, I just did a random Google search on some of these forms, and just for random different insurance companies, and just here are a few that popped up. So we'll just take a look at these. So here it just says claim forms, Blue Cross, Blue Shield, Blue Care Network of Michigan, and it says who is this for? And this right here says if you recently visit a doctor outside of your network and you need to submit a claim, you can use one of these claim forms. So basically, you guys are out of the network, right? You're independent facility or independent operator. You're out of their network, right? You're not credentialed with their network, but these patients come to you to get a to get an ultrasound service and to get an ultrasound reading, and so they're going to be working with you directly, which is outside of the insurance network, but the patient in turn is gonna pretty much handle the arrangements, and then in turn, they're gonna go to their insurance company and say, "Hey, I had these services performed out of network. It was a pretty reasonable price. Now I need to submit a form for reimbursement so that it's covered by you guys instead of me having to pay it out of pocket." And so this is pretty much how it works, guys. So just keep in mind you're just pretty much an out of network provider, and you're helping your patients get reimbursement for services that you perform for them. So as I say, is even if you have a medical, vision, or dental or prescription drug coverage through Blue BCBS of Michigan or a Blue Care Network, there may be occasions when you have to pay for services yourself. For example, you have to see an out of network doctor that doesn't accept your insurance. So you can use these claim forms to ask us for reimbursement. Just choose the form based on your group or plan in the service. You'll go to a page that explains the form and has a link to it, and download it. Sometimes the form is called member application for payment consideration, which is the same as a claim form. If you were on a cruise, you use the same claim form for reimbursement of medical expenses. So guys, I mean honestly this happens more than you think. Let's say you have an individual that's out of town, and let's say they're like 10 states away or whatever. Let's say they're from Georgia and they're in California. There's nobody that they can find a network to take them. They go and get medical services from this certain provider. The provider can then help them submit a claim for reimbursement for those services performed. So this is pretty much how it works, guys. This is very, very common. So if you have any questions, call the phone number on the back of your subscriber ID card, also known as the enrollee ID, or contact us and we'll help. So guys, keep in mind, like if you're getting that patient's insurance card and you're gonna help them, you're getting a copy of that card and you're gonna help them file that claim. If you can't find the reimbursement form, simply just call the number on the back of the patient's ID, insurance ID card. And so once you call that number, you'll be able to ask them for that form, and they can usually send it to you directly via email, or they can fax it to you, or they can send it to the patient themselves, and then the patient themselves, you guys can get together and fill that form out. So this is pretty much how it works. So now we'll just go and just look over some other sites. So here is another form and site that we search for fepblue.org. So here we just clicked on this. Again, guys, if you use a provider outside of the network, you will need to complete and file a claim form for reimbursement. So then we clicked on that, and here's an example of one of those forms. So this is for the Federal Employee Program for BCBS. So it's going to be a little different, but very similar to what you're going to see in a lot of these forms. Basically, you want to read through all of this and just fill it out as thoroughly as possible. Make sure you don't leave anything blank for the areas and sections that are required. So, I mean, it's pretty self-explanatory. So here's another one we search for my United Healthcare, which is a very, very popular insurance provider. So we'll just kind of go through this really quick and then we'll wrap things up. So who is this form for? So this form is for out-of-network claims only to ask for payment for eligible health care you have received. Again, guys, this is like the patient is receiving care from you. You are an out-of-network facility or provider, and you're just simply going to help the patient get reimbursed for those services that they're getting from you and your company. So just follow these instructions. I'm not going to read through all of this. Um, let's see. So here, this part is important. Ask your provider to give you a super bill or invoice that includes all of the following for each date of service. So guys, this part is really important because this is where your super bill or invoice is going to come in handy. So this information must be on the super bill as it is required to process the claim. Missing information can result in a delay or non-payment of the claim. Please be sure the information is clear and readable. So you definitely want to have the patient name, preferably the date of birth for the patient as well. You want to include the diagnosis code with the claims with date of service. After October 1/16 must be ICD-10. Guys, again, don't worry about this. If you are in the consulting program, the online consulting program, and the online consulting portal, you're gonna have all of the ICD-10 codes. You're also gonna have an order form as well. If you would like to provide the order form directly to the physician, you guys can do that. So if you are in the my mobile ultrasound business.com online consulting program and in that online portal, you guys are gonna have access to all of this. So and we make it very easy because you want this process to be easy as possible. You'll simply take that order form, you'll send it over to the physician, they'll fill it out, they'll put in the ICD-10 codes. You can also help them. You can send over a copy of the ICD-10 codes to make it easier for them. And also the CPT codes as well is going to be provided in the mobile ultrasound program portal as well. So you guys are going to have the CPT codes and the ICD-10 codes as well as that order form, so you can easily send it over to the physician so they can fill that form out, get it back to the patient, and now the patient has an order form, right? So you want to have this order form because you're going to have to list all of that information that the physician and the nurses provide and their doctor's office provides for you in order to submit these reimbursements to companies and insurance providers like United Healthcare. So yeah, you're going to do that, and then you're also going to put procedure codes on there. Again, this should be provided by the physician. You're going to have that documentation of all the ultrasound CPT codes. So don't worry about any of this. If the physicians have any questions, they're going to refer to the packet that you send them with the information on how to fill out the order form. That all of that is included and provided to you for use in the mobile ultrasound consulting program. So you're going to put the units for each procedure code. You're going to put the billed amount for each procedure code. And then you're also going to include the place of service code as well. So how to get the maximum benefit. So this is just telling you guys how to get the maximum benefit for reimbursements. It says use a participating provider to receive the maximum benefit. DME and ongoing services such as physical therapy are especially cost effective with a United healthcare provider. So all this is saying is just they want you to use their providers, but you can still use out of network providers. So for the patients, they can review their benefits at this site. For services that require prior authorization or notification, be sure to call the member service number on the back of your health plan ID card. So guys, this is just saying pre-authorization. For most ultrasounds, pre-authorization is not required. Sometimes for echo services, it is required. But I mean, if you guys want to be safe on the safe side, you can have your patients call, or you can call and check on your patient's behalf for to make sure that those services right there are required, or that those services are going to be recovered, rather. So that part is up to you guys. Usually, I mean, it is covered usually, just as a general rule. So what happens next? So after we process your claim, we will send you an explanation of benefits, which is an EOB. The EOB will explain the charges applied to your plan deductible and any charges you owe your healthcare provider. Please keep your EOB on file for future reference. You also may review your EOB information online at myuhc.com. Once you have completed the form, mail it to the address listed on the back of the health plan ID card. Be sure to attach the super bill or invoice and add any receipts of your payments. So, like I said, guys, um, if you're doing, if you're going to be sending out that information, just make sure you include like the price of the service, what the patient has paid. Just pretty much just include all of that information, but you're going to have that in your accounting software and your invoice software anyway. So just make sure to include all of that information. And that way, if the patient has paid their $85, then you're just requesting an additional 100 because your entire service costs 185. Then if you guys have the patient fill out an AOB, assignment of benefits form, and this company hypothetically approves the claim, that 100 just goes straight to your company. It just bypasses the patient. So just make sure you include all the information, guys. So here on the form, like I said, you guys are going to work with the patient to fill this out. So it's simply just their member ID, their group number, patient's information here, just simple things here, their relationship to the subscriber. Then you're going to include the policyholder information. Sometimes it's going to be different than the patient. If not, it says just complete this section only if it's different from the patient information. So you'll just fill out all of this, and then here is your part as the mobile ultrasound imaging provider, or just the imaging provider, period. So this information is required to process the claim. Ask your provider for this information or have them fill it out for you. So guys, like I said, you can work with the patient to fill this out, or you can just fill it out for the patient. So you're just going to put your provider name. This may be your company name or your individual name, just depending on how you have it set up and registered. You're going to put your NPI number. If you're a member of the Ultrasound Consulting platform and the Ultrasound Academy online, you're going to have that information on how to get and how to apply for your NPI number if you don't have one. So you do want to have that NPI number so you can submit the information over and fill out this the correct way. You just want to put your address, whatever your address is for your NPI number and your company. You're going to put your city, your state, your zip code. And then here, you're just going to put your tax identification number. Again, this is something that we discuss in the online consulting program. So you're just going to put that information. You're going to put your group facility name. So this is going to be actually your company name here. Here is going to be more so your provider name, your individual name, the person that provides the service. Now, these two could be the same or these two could be different. So just keep that in mind. Most NPIs, they're just going to be under like one individual person. Sometimes they are under a group and facility. But yeah, that information is going to be in the mobile ultrasound business online consulting program portal. So here is the address where services were rendered. So you're just going to fill out that information. If it's mobile, then you're just going to put the place where the services are rendered. Or if it's in your office, in your facility, you're just going to put that information right here. You're going to input the phone number, zip code, state, city, and then you're pretty much done with your part. So it's very, very simple, guys. Just make sure you fill out this part completely. So this part is more so for the patient. It's accident. If it's not an accident, this is just, you're just not gonna fill it out. If it's not an accident, you'll just write like NA in this section. So other insurance, if the patient has other insurance policies, you're just gonna put that here. So this part is more so for the patient. So this last part is important. So we talked about the AOB, assignment of benefits. So if you guys use that assignment of benefits form, you're gonna be able to um, have your company have your company receive the reimbursement directly, as opposed to having the reimbursement and the claim go to the patient and then having to collect from the patient. So in order to check this, just make sure you do have the AOB form filled out from the patient, because you do want to make sure you legally have permission to accept benefits on behalf of the patient. So you do want to have that form filled out and full and have the patient sign it. Pretty much just it says, hey, I'm the patient. I'm giving permission for XYZ mobile ultrasound imaging company to accept reimbursement, accept payments, and accept the benefits from my insurance program and in my insurance plan. Very simple form, but very important. Again, this is in the mobile ultrasound consulting platform that we offer. So don't worry too much about this. Just make sure your patient fills it out. But if you do want to get the payment directly instead of having it go directly to the physician, you will check this box. I'm sorry, not to the physician, but if you want to get the payment directly instead of having the payment go to the patient, check this box. Make sure they fill out this form. So please check this box if you want to have UHC pay benefits directly to the doctor or provider. And then this is pretty much it. The patient is going to sign here. Patient is going to date. And you guys are just going to send it off to wherever they tell you to send it. So this is pretty much it, guys. Um, if you have any questions, please leave a comment. Please, like this video if it was informative. Just let us know. Give us some general feedback. So again, this is Austin with www.mymobileultrasoundbusiness.com. If you have any questions or want to book a consulting call, just go over to mymobileultrasoundbusiness.com and you can do so there. Thanks.